Hi, hello, good evening, everyone. Welcome to iMumz Ask Me Anything session. And today we have a very senior gynecologist and obstetrician with us. We have Dr. Bhaskar Pal sir from Calcutta. Welcome, Bhaskar sir, to iMumz Ask Me Anything session.
Thank you.
So today is the 131st iMumz Ask Me Anything session. So I'd like to take the pleasure of introducing you to all the viewers, lovely to-be mothers out there. So Dr. Bhaskar sir is a very senior obstetrician from Calcutta, as I told. He's currently associated with Apollo Hospital in Calcutta. He's a very senior consultant there. He was trained in Mumbai and UK for all his studies, and he's a very well-known. He's a great orator, and he delivered more than 500 lectures in many various national and international conference. Being a person with huge academic interest, he has more than 35 publications to his credit. So today he's going to speak about hypertension during pregnancy, what you should be doing if you're already hypertensive, or you have the tendency of being hypertensive. So he will be giving all the wonderful suggestions for all of us. After that, he will be answering all your questions. So please post your questions in the comment section, and Dr. Bhaskar ji will take them soon. Over to you, sir. We are eager to know from you more about this topic.
Thank you, Ravi. Thank you for the kind introduction. And good evening, everyone. I welcome you all. I hope you are enjoying your pregnancy. What is important to understand is that right at the outset, that pregnancy for most of you is going to be a very normal and very pleasant experience. Pregnancy is not a disease. Pregnancy is a normal physiological event. So it is more importantly, pregnancy is a journey. So it is important to enjoy the pregnancy. And we are fortunate that 95 out of 100 will not have a problem in the pregnancy. Having said that, it is important to know about the problems that can happen, and it is important to be educated about them. Now, when we talk of hypertension in pregnancy, what is hypertension? Hypertension means your blood pressure going up. Hypertension doesn't mean getting too much of tension. It just means that your blood pressure going up. Now, there are two kinds of hypertension that we talk about in pregnancy. Some people do have hypertension even when they're not pregnant. We call it essential hypertension. So somebody who's hypertensive might get pregnant. And more commonly, we have an entity called pregnancy-induced hypertension. Now, what is pregnancy-induced hypertension? This is a situation where the hypertension, a new hypertension arises in the pregnancy. And it arises in some women, and it is very difficult to predict it. Also, although right now we have some prediction tools, it is very difficult to predict it. Now, what is important to understand is that there are some, God is great, nature is great. So nature has put forward certain changes that occur in the body in pregnancy, which is beneficial to the mother and the baby. Now, if you imagine that you have a metal pipe through which water flows in your house, however with the force you push the water, the amount of water that will come out from the other end is constant because the metal pipe cannot expand. Whereas if you have a rubber hose pipe, like the ones you use in the garden, if you push water with a lot of force, more water would come out because that pipe can expand. The same thing happens in pregnancy approximately around the 3rd month. So the blood vessels of the mother, from which supply blood to the baby, they undergo such changes. We call it that they change from high resistance vessels to low resistance vessel. In simple words, it changes from, say, a metallic pipe to a rubber pipe, so that if the mother system wants to push more blood to the baby will get more blood, which is important for the baby's nutrition and growth. Now, unfortunately, in some women, for whatever reason that which medical science doesn't know, these changes do not occur. And that approximately happens in 5 out of 100 of first-time pregnancies. And that is why, because sufficient amount of blood doesn't flow to the baby, one of the two things can occur. The mother's blood pressure can go up, or the baby might not grow as well as the baby should be growing, which we call a slightly different topic. We call it the baby not achieving its growth potential. Now, this new onset hypertension usually tends to happen in the second half of the pregnancy. It is very unusual to get it before 20 weeks. In fact, what happens to blood pressure in pregnancy is around 16 to 20 weeks of pregnancy, that is between your fourth and fifth month, the blood pressure actually comes down a little bit, which we call it a mid-pregnancy drop in blood pressure. And whoever is destined to get hypertension in pregnancy, that usually can start after 20 weeks. Now, it can be mild, it can be severe. Fortunately, again, majority of them are mild. The milder the problem is, later on in the pregnancy it arises. In some people, it can arrive even in the last week of pregnancy. The sooner it starts, for those in whom it will start around, say, 24 or 26 weeks, in them it tends to be more severe. Now, what are the things that you need to know about your blood pressure? So what are the things that you should be aware about? Now, number one, every time you have an antenatal visit, what the doctor does is the doctor checks your blood pressure. If your blood pressure, normally what we would expect that the blood pressure, the cutoff that we lay for the blood pressure is, your blood pressure is always a figure by a figure. And the top one, we call it the systolic blood pressure. The bottom one, we call it the diastolic blood pressure. Usually the top one is higher. So you might have a blood pressure which is 90 by 60 or 100 by 60 or 110 by 70 or 120 by 80. If the top one goes to 140 or more, or if the bottom one goes to 90 or more, then we will be we'll start monitoring you a little more, saying that this is pregnancy-induced hypertension. Now, whenever you have that hypertension, what the doctor would suggest is to check your urine, whether there's what we call protein in the urine, and also to do some blood tests to see whether the blood tests are all right or not. Do everybody who gets hypertension in pregnancy need medication? No. We would start medication if it goes to above, say, 145. Some people will start it at 145. Some people would start it at 150. And the bottom one, some people would start it at 95. Some people would start it at 100. Getting the blood pressure down is not the only problem. I've already explained to you why the blood pressure problem occurs. So what happens is that as a medical professional, what we try to do is to essentially to look for whether you are getting any complications because of the hypertension. Now, what kind of complications can happen because of the hypertension? Two kinds, one for you and one for the baby. For the baby, I have already said what happens is that we need to monitor the baby's growth, because the hypertension and baby's growth problems can occur due to the same reason. So you will need ultrasonography to make sure that the baby is growing properly. What can happen to the mother? Some of you might have heard the dreaded term called eclampsia. If somebody in your family ever had eclampsia, you would have heard that name. And eclampsia, once upon a time, was a dangerous condition where you get hypertension in pregnancy, and along with that, you have convulsions. Fortunately, these days, because of good care during the antenatal period, we can diagnose pregnancy-induced hypertension soon enough, and we can monitor you, and we can deliver you before you get to the stage of eclampsia. But eclampsia is a dreaded complication. And the other problems that can occur is that the liver enzymes, the enzymes for the liver can go up, etc. Now, what kind of monitoring that we do? We keep on monitoring your blood pressure. We keep on monitoring for some symptoms and signs. And we also keep on looking at your blood tests. And the blood test, we keep on looking at your liver enzymes. And also we look for in your blood a certain count of something called platelet count. Like you have white blood cells, red blood cells, and platelet, we look at the platelet count. If the platelet count falls or the liver enzymes go on increasing, that is when we would be we'll start getting a little worried, and we will think of delivering you. Now, what is the treatment of pregnancy-induced hypertension? Before I come to that, I think what you need to know that if you have hypertension, what you need to be doing. Is there a role of salt restriction? Not really. You should not have any extra salt in your when you are having your meals, but putting salt in your cooking is absolutely fine. Is there anything to do with diet? Not really. So what are the things that you need to do is that your doctor might ask you to monitor your blood pressure at home, and that is very important. And there are some signs and symptoms that you should be looking for. And what are the signs and symptoms that you should be looking for? Number one, if you get a headache, then you need to contact your doctor. If you get visual disturbances, there are two kinds of visual disturbances that can occur. The one kind of visual disturbances is that you cannot see clearly, and the second kind of visual disturbances that if you have, say, you close your eyes and you see in front of your eyes there are some lightning type things going on, etc. The third thing to look at is, number one is headache, number two is visual disturbance, number three is that if you get a pain in your upper tummy on the right side in the region of your liver just below your rib cage. That is the third one that you need to be looking at. The fourth thing that you need to be looking at is if you feel that suddenly the amount of urine that you pass during the day, to you it looks that it has decreased in quantity. And the last thing that you need to be looking at is that whether you're getting swelling of the body and the swelling, more importantly, swelling of the hands and face. Please remember that swelling of legs is a common thing that happens in pregnancy, and if your blood pressure is normal, you just need not be worried about that. But if you're swelling, suddenly your hands swell up or your face swell up, that is something that you need to be worried about. And what do we do as doctors? As doctors, we keep monitoring you. How do we monitor you? We monitor you for these symptoms, and we also monitor you essentially by looking at your blood tests. And how often do we repeat the blood test? It depends on whether the problem is mild or whether the problem is severe. If the problem is mild, then we would repeat the blood tests about once a week. If the problem is severe, we might want to repeat the blood tests even 2 to 3 times a week. What is the treatment? Unfortunately, the only treatment is delivery. And when would you like to deliver? If your blood pressure is absolutely, your blood pressure is high, and your blood tests and everything is normal, you have no protein in your urine, then we would like to deliver you at term, which means that around your expected date of delivery. If you develop protein in your urine and your blood pressure is also high, but your blood tests are reasonably normal or slightly deranged, then we will like to deliver you at 37 weeks. However, if your blood results are not too good and if keeps on worsening, then we would like to deliver at 34 weeks. Do we ever need to deliver before 34 weeks? Yes. In very, very rare cases, we do need to. And we need to do that if we think that you are getting these symptoms and your blood results are abnormal. And by waiting, what might happen that you might have a convulsion. And we call that a imminent eclampsia. And there, apart from delivery, also we put you on some anticonvulsants for about 24 hours to prevent that from happening. So this is essentially about hypertension that arises in pregnancy. If you have if you already have hypertension and you get pregnant, the good thing to do, the right thing to do would be that when you are planning pregnancy, to visit a physician as well as a gynecologist and decide whether the antihypertensives or the blood pressure medications that you are taking, they are safe to be continued in pregnancy, otherwise change them. Whereas if you're already on antihypertensives and you suddenly discover you are pregnant, I think it is most of the times what we would do is we will just change the medications to something that we know is safe in pregnancy. There are plenty of antihypertensives in the market, but unfortunately, very few of them have been tested for safety in pregnancy. So we use only 3 or 4 antihypertensives during pregnancy. So this is all that I had to say to initiate the discussion, and I would be happy to answer any questions that you have. Thank you.
Thank you so much, sir, for simplifying such an important topic and for this wonderful knowledge. We have many questions. Shall we start taking questions, sir?
Yes, please.
Okay. First question of the day from Ritu. Can coconut water contain sugar? Is she asking?
Not really. I wouldn't worry about, what you need to be worried about. You need to be worried about looking at drinks where there is added sugar. So coconut water, normally we wouldn't ask you not to take coconut water for fear of having sugar in that. If you develop diabetes in pregnancy, that is when we would be worried about your fruit juices. It is much better to take fruits rather than fruit juices because 1 fruit juice is equivalent to 4 fruits. So we would be a bit particular about what fruits and fruit juices you are having, only if you have a problem, if your sugars go up. If you please know that India is the diabetes capital of pregnancy. A lot of women develop diabetes during the pregnancy, which we call gestational diabetes. The term gestational because this diabetes will go away once you deliver. but that is a warning sign. The warning sign meaning that in future life, if you do not modify your lifestyle, you are more prone to get diabetes. And we check for gestational diabetes when you first present in the pregnancy, again around the 5th month, and around, some of us do also check it around the 8th month. And if that happens, that is when we put dietary restriction. Otherwise, coconut water is absolutely fine.
Thank you, sir. So you can enjoy coconut water, Ritu. Next question we take from Rashmi. Is PIH responsible for breakage of water membrane?
Not usually.
Okay.
Not usually. The PIH, as I said, that what had happened in PIH, number one is for medical reasons that we might have to deliver you early. And if we have to deliver you early, obviously there are issues with prematurity, but we would only deliver you if you think that continuing the pregnancy would pose a grave risk either to you or to the baby. Also, that is why the prematurity is essentially because we have to deliver you early. It is nothing to do with labor starting early or anything to do with the problem of breaking of waters. But the other complications that can happen with that, apart from eclampsia, is that what we call a very dangerous complication, which is called abruption of the placenta. That is where the placenta of the afterbirth starts getting detached from the wall of your womb. And that will give rise to pain, and that can cause as an emergency, that can cause danger to the baby. And that is why it is the importance of keeping the blood pressure under control and delivering you if you think the risk go up. But no issues with breakage of water.
Thank you, sir. Nivedita has a question. She's in the 6th week of pregnancy. She's faced a deep yellowish vaginal discharge, and now it's currently brown in color, she's mentioning. So is it something to be worried about? She's having mild on and off lower abdominal pain. So is it something to be of concern?
Vaginal discharge is very common in pregnancy, and unless you have itching or with that, or it is foul smelling, we wouldn't worry about it. Having said that, if the discharge is brown, it is more likely that there is some blood in it. Now, while a blood-stained discharge can happen normally in early pregnancy, we can only say that in retrospect. So any bleeding in the pregnancy has to be viewed with caution. And if you are in the 6th week of pregnancy, especially if you've completed 6 weeks and you have a brownish discharge and some pain, what I would recommend that you need to see a gynecologist, and you need to have a sonography, which ideally should be a sonography from down below, what we call a transvaginal sonography, to make sure that the pregnancy is all right. So any pain, any brownish discharge, any bleeding in early pregnancy has to be taken seriously, but many of the time they're not cause for concern. So if the ultrasound is fine, we would be happy.
Thank you, doctor. Next question by Richa Maheshwari. She's in 28th week DCDA twin pregnancy. The BP was 140/70. The doctor advised for no or low sugar diet. She's hypothyroid, taking 150 mcg Thyronon. Her growth scan and color Doppler was normal. What are the chances of hypertension, eclampsia, or gestational diabetes in the case of twins? And if due to any, okay, and how to avoid and take care if it occurs?
We would not worry about, you have not at a higher risk of hypertension in a twin pregnancy or of that of diabetes. Twin pregnancy has its own set of problems. Fortunately, you have a DCDA twins, and the DCDA twins are unlikely they'll compete with each other to get a fairer share of your of the nutrition that you are providing to them. But having said that, what you need is a 4-weekly growth scans. Your risks of having hypertension would more or less be the same as in a first pregnancy, and that is between 5 to 10%. Gestational diabetes, I do not know why your doctors ask you to be given you some diet control. Maybe that your sugars have been borderline. It is always good to cut out on extra sugars, and that is important. So essentially, walking around half an hour a day, and cutting down on fried food and cutting down on sweets and etc. stuff when your sugars are normal, even then they're good to prevent gestational diabetes.
Thank you so much, sir. Next question we take from Anirita Das. Simple cyst up to 5 centimeters, is it dangerous for pregnancy? What up to what size it is normal?
I want to know that there is nothing called a normal size in pregnancy. It is a question of that when we detected the cyst in the during the pregnancy, or we knew that the cyst was there even before the pregnancy. If you had a cyst and doctor told you to go ahead and start planning for a pregnancy, obviously your doctor is not worried about that. When you are not pregnant, there are absolutely two different issues about when we would operate on a cyst. We would operate on a cyst if it is more than 5 centimeters, which means 6 centimeter or more, because they are more prone to twist. Or we will operate on smaller cysts if they are symptomatic, like if they give rise to pain. Um, However, if we discover that you have a cyst while you got pregnant, we would normally do not interfere with the cyst at all unless the cyst gives rise to problems, which means that if the cyst starts causing pain, etc. Um, Usually, cysts of 5 centimeter do not twist. That risk of torsion goes higher if it is more than 6 centimeter. And in pregnancy, there are two times when the cyst can twist more commonly. One is when you are getting into the 4th month of pregnancy, because that is where your womb from your pelvis gets into the abdomen, and that is where the cyst finds a lot of space where it can twist, or immediately after delivery, because the uterus your womb will shrink in size, and then again suddenly the cyst will find a lot of place where it can roam around, go for a walk or a run, and get twisted. But yes, normally if we find the cyst in the pregnancy, unless we have problems, we wouldn't do anything to the cyst.
Thank you, sir. Next question by Unnati. Can she drive in the first trimester?
Unnati, you can drive in all the trimesters. You can drive in all the trimester till such time that it is becoming mechanically difficult for you to drive. In the first trimester, there's absolutely, as I said right at the start, that pregnancy is a normal event. If you do not have complications, please treat pregnancy as a normal event. So eat normal, drive normal, have sex normally, go up and down the stairs normally, get on with your job normally. There's absolutely no issues with that. There are issues about, as you get into advanced pregnancies, there are issues about how you should put the seat belt. You need to see that the lower belt goes below your uh, the pregnancy bump, and the upper one goes in between your breasts. That is what is important. But you can drive even up to the day before you deliver.
Thank you, sir. When should be the target scans done? Neha's question.
At the present moment, we advise everybody 3 scans and sometimes 4 scans. The 3 mandatory scans are: the first one is between 11 to 14 weeks. In 11 to 14 week scan has essentially 3 purposes. Number one is to do a Down syndrome screening. If you've heard of Down syndrome, and I'm sure that Ravi has arranged something on Down syndrome before. The second thing, it is also treated as an early anomaly scan. A lot of anomalies in the baby. Please understand that approximately 1 in 200 babies will have a major anomaly, and most of these can be picked up on that scan. The few ones which cannot be picked up on that scan is essentially the cardiac issues with the baby. Thirdly, some people have already started doing a screening for hypertension in pregnancy during 11 to 14 weeks. So these are the 3 essential parts of the 11 to 14 week scans. The second scan, which is mandatory, it's between 19 to 20 weeks. We traditionally call it the anomaly scan, and that is to make sure that baby's all organs are proper and fine. And the third scan we do is one between 32 to 36 weeks to see that the baby is growing properly. Sometimes we add a 4th scan, which is early in the pregnancy, as soon as we diagnose the pregnancy, between 6 to 8 weeks, to make sure that everything is fine, that this is just to make sure that you're not carrying twins, that there is no bleeding inside, all these things. But that can be omitted as well. And if you do not have any problems, many people would, especially if you go to the Western world, many places have the first scan at 11 to 14 weeks if there is no problem till then. But in our country, most of us like to do a scan around the 7th week of the pregnancy as well. And that's the 4th one.
Thank you, sir. Tanvi's question: she missed her abortion on 26th June when she was 6.2 weeks pregnant. Can she try again to conceive? It's been 2 months. Uh, Kindly suggest if this is normal. This is the first miscarriage and second pregnancy. If she should try now, and when should she plan for pregnancy again?
Okay. Number one, the miscarriages are a very, very common event. And 1 in 7 pregnancies end in a miscarriage. And the reason most of these miscarriages are in the first 3 months of the pregnancy, and the baby's heartbeat wouldn't even appear. And if that is so, we wouldn't worry too much, because it is nature's way of getting rid of pregnancies which have a chromosomal abnormality which won't be viable with life. So that is, if you just have one miscarriage, even early in the pregnancy where the fetal heart didn't appear, you really do not need much investigations. When can you get pregnant? There is actually no reason to put a limit on when you should try for getting pregnant again. We would say that as soon as you physically and mentally feel ready to get pregnant. But what we normally suggest from a practical point of view, that you should get 2 or 3 normal periods before you start trying again, so that we are sure that there is no complication left over from the previous miscarriage.
Thank you, sir. We wish you all the best, Tanvi. Next question by Sandhya. She's 25 weeks pregnant. When she starts walking in the evening, she's feeling pressure, and on every 5 minutes, she feels like urinating, but she's not able to urinate much. It's only 2-3 drops. Can she walk or not? She's asking.
Yes, absolutely, you can walk. Sandhya, I did not get, Ravi, how many months in the pregnancy is she?
She mentioned she's
Did she
25,
mention that?
25 weeks pregnant, sir.
25 weeks pregnant.
Yeah.
I think what would be important to check, Sandhya, that you do not have a urine infection. So make sure that your urine routine and culture examination has been done. So that is what needs to be done and needs to be checked. If that is so, yes, you can continue walking. There's absolutely no problem. But make sure that there is no urine infection going on. What happens is sometimes the pregnancy irritates the bladder, and as the pregnancy advances, you might feel like passing urine a bit too often, and with not great quantities, because what has happening in the pregnancy is pressing on the bladder, so the bladder capacity temporarily is not much, so you start feeling the pressure much sooner. So if you do not have a urine infection, just do not worry about it, and keep on walking.
Thank you, sir. Niharika's question. She's in 33 third week of pregnancy. She's having breathing problem and swelling in the stomach and legs. The BP is 130/90 and 140/90. Is there any problem?
Niharika, it may be or may not be. If you have a blood pressure which is borderline, which is 130/90, 140/90, then you need to see a doctor who needs to check whether you have protein in your urine. That's number one. And number two, that they need to, if there is protein in the urine, they also need to do a baseline blood test that to check that everything is fine. So essentially, you need to be under monitoring. Uh, so at the present moment, I think what is important to see that your bloods are fine, and also with an ultrasound to make sure that the baby is fine. 96 kgs, yes, there's a vague relation between mother's weight and the risk of gestational diabetes as well as hypertension. But I think what is important is that we need to make sure that we need to monitor your blood pressure. At the present moment, we need to check your bloods and your urine, and also the baby's uh, ultrasound to make sure that the baby is growing fine. But this is a dynamic situation. So if you have pregnancy-induced hypertension, things can change. So you need to be on more frequent monitoring by the doctor to see that things are fine and no complication is setting in.
Thank you, doctor. We wish you all the best, Niharika. Next question by Aisha. Do we get hypertension in every pregnancy? And from C-section, can do 3 children only?
Okay, Aisha, I will answer your two parts to both the questions. Do you get hypertension in every pregnancy? No. As I said, that the hypertension in pregnancy tends to happen more commonly in the first pregnancy. So if 100 women get pregnant and it is their first pregnancy, approximately 5 to 10 of them will have hypertension in that pregnancy. If you do not get hypertension in your first pregnancy, it is very unlikely that you will get hypertension in your second pregnancy. Hypertension in second pregnancy tends to happen in those partner of your in the two pregnancies is more than 10 years, because that is how it works. And if you get hypertension in one pregnancy, what are your chances of having it in the next pregnancy depends on how severe it has been. If it is a severe hypertension, then the risk of it coming back is higher. If it is mild, it might not even come back. About C-sections, what is important to understand is that in general, when you have your first cesarean section, it is almost as safe as a normal delivery, as safe as a vaginal delivery. But with successive cesarean section, the risks increase. which means that the things might be stuck inside, and that is why the risk of injury to other organs increases. Also, your placenta of the afterbirth might get stuck to the uterus. That can cause bleeding, and that can have very, very serious implications. And the risk increases with every successive cesarean section. So it is not that you can have only 3 cesarean sections. You can have more, but obviously the risk in the second cesarean is more than the first, in the third more than the second, in the fourth more than the third.
Thank you, sir. Next question by Shweta. She's 24 centimeters fundal height is normal in 26th week of pregnancy.
Sweta, who's measuring your fundal height, please do not bother measuring fundal height at home. As I said, treat pregnancy as normal. If your doctors measure it, yes, up to 3 centimeter lag is absolutely fine. Fundal height is a very poor way of assessing the growth. The reason we see the fundal height is essentially to see whether we would send you for a scan early or not. So which means that if you're in 26 weeks of pregnancy and your fundal height is less than 23 centimeter or more than 29 centimeter, then we would need to do an ultrasound to make sure that the baby is not growing too big or the baby is not achieving its growth potential. But most of the times when we'll send, the ultrasound will turn out to be normal.
Thank you, sir. Darshika's question, she is in 16th week of pregnancy, 17th week of pregnancy, sorry. In the past 4 months, there is no increase in the weight. Is it okay?
I keep telling women that I check weight only for the mothers and mothers-in-law. What happens is we need to know what is your initial weight when you get pregnant. And also we need to know if we will be worried if you are gaining too much weight in the pregnancy. Babies are actually very selfish. The famines have taught us that even during the famine, the birth weight of the babies did not go down, which means the babies took food from the mother's reserve. So actually the Western world has stopped measuring weight in every visit of the pregnancy. They will start taking your weight only if you get diabetes or if they think that you feel that you gain too much of weight. So that's number one. Number two, it is common to lose a bit of weight in the first 3 months of pregnancy, and that is because of if you get too much of vomiting in the pregnancy, and that's absolutely nothing to worry about. So no, I think it is not important if you've not gained much weight. What is important is to keep an eye on the baby. Very soon, if you've had 17 weeks, then very soon in 2 to 3 weeks, you'll have your anomaly scan. And I'm sure you'll put on some weight during the pregnancy. Most women do not lose weight during pregnancy. But having said that, you can see a bit of loss of weight in between 2 visits. And that is because our weighing scales are notoriously inaccurate. So we really do not, it is absolutely no point in checking your weight every now and then.
Thank you, sir. Shravanti's question, what is cisterna magna? In the 20th week USG report, that cisterna magna appears prominent 6.12 mm. As per the gynecologist, she consulted with a fetal expert where the report came negative. Again, she did the USG on 29th week and it says that cisterna magna appeared prominent 7.7 mm. Is it something to be worried?
I wouldn't worry too much about it. An isolated cisterna magna, which is prominent and there is nothing else, what happens is that is something that fetal medicine experts would say they are of doubtful significance, but we need to keep an eye on that. So if that persists in your subsequent scans also, what they will do is they will do an ultrasound on the baby soon after the baby is born to see if there is something. And even if there is something, they would plan for an MRI of the brain at a later stage, but usually they are innocuous and there is nothing to do, no abnormality associated with it.
Thank you, doctor. Shilpi's question is it normal feeling movements in 5th week of pregnancy? It's a second pregnancy. Kindly
for whatever reason, Shilpi, in second pregnancy, women tend to feel movements sooner than in the first pregnancy. So in the first pregnancy, women would start feeling that movement or the first movement, which we call quickening, between 20 to 24 weeks. And whereas in the second pregnancy, people would feel it between 16 to 20 weeks. So it's absolutely fine.
Thank you, doctor. Next question by Priya. Sometimes she's having pain in the eyes and head, but the BP is 118/80. Should she be worried? Currently 20th week of pregnancy. The pain is around from 4th month of pregnancy.
No, I don't think you should be worried about any pain in your eyes and head if your blood pressure is normal. So if you have a pain in your eyes and your head, the first thing to do is to consult an ophthalmologist to check that your eyes are fine. What is happening during this pandemic is all of us are spending too much time on either on our mobile screen or on our laptop screens or on our iPad screens, and that causes a problem. So I think your eyes need to be looked at. And what happens is, the other thing that very commonly happens is you might have a power in your eyes which you did not know. That's number one. And number two is that you get dry eyes with staring at the screen. So sometimes the eyes might need to be hydrated. But your blood pressure is normal. Please do not take this as a complication of hypertension. No, it isn't.
Thank you, sir. Apeksha's question: is it possible to get hypertension, high BP after you go into labor for few years while the labor lasts?
Apeksha, what is your blood pressure can, as I said, that the blood pressure has got two components. One is the upper one is the lower one. The upper one can increase any time that you get worried. We have something called a white coat hypertension. And what is a white coat hypertension? That is something that your blood pressure goes up every time you go to the hospital and go and see a doctor. And so if your blood pressure, which is the upper one, goes up a little bit during the hospital visits, we just need to keep an eye on you, but we wouldn't mark it as a pregnancy-induced hypertension. Similarly, whenever you're going through labor, it is quite common for especially the upper one to go a little higher. But yes, hypertension in pregnancy can present during labor. It can very rarely present even after delivery, in the second day or on the second day or the third day. So we need to differentiate that from transient hypertension that occurs because of anxiety or because of pain. So which means that if you get it in labor and if it persists, it's something to worry about. If you get it in labor for a few hours and it goes off, we wouldn't worry.
Thank you, sir. And next question by Barsha. She's 14 weeks pregnant, and in the 12th week, she started bleeding, which the doctor diagnosed as subchorionial hemorrhage in the uterine wall.
Yes, Varsha, this is a subchorionic bleed, and subchorionic bleed means it is a bleeding that has occurred in between the pregnancy and the wall of your womb. Now, what are your question is, or what are your chances of having a miscarriage? Now, if he's on the 12th week scan, I assume that the fetus is doing well. It is very difficult to quantify the risk of miscarriage, but there is a small chance of miscarriage if you have a subchorionic bleed. So you need to be careful, and usually your doctors will put you on medication to keep the uterus quiet. Most of the times the subchorionic bleeds go away, or you might just pass a clot and that's how it gets expelled. The risk of miscarriage is associated with the size of the subchorionic bleed, more importantly. But unfortunately, it's very difficult to predict, so we need to wait. We need to put you on medications which will keep the uterus quiet, and we need to restrict your activities. It doesn't mean bed rest, but essentially on house rest, and then we need to repeat the scan after 2 to 3 weeks to see what is if we see that it is getting smaller or it has disappeared, then your risk of miscarriage is gone. But we need to keep an eye on it till it goes. So subchorionic bleed is not normal. Yes, it is a sign of worry, but if you have a subchorionic bleed, in most people it will resolve on its own, and only in a very small number it will cause a problem.
Yeah. Thank you, doctor. Next question by Priyanka. She's 16 weeks pregnant. She had chemical pregnancy in the February. Do she need to take some extra care this time? All the reports are fine till now.
Priyanka, not at all. You had a chemical. What is a chemical pregnancy? A chemical pregnancy is when you do a pregnancy test and it is positive and nothing can be seen on ultrasound, and then you get your periods. Now, what would happen is you found out you are pregnant because you did a pregnancy test. If you didn't do that, you would have just thought that your periods were a bit late this time. So I said that 1 in 7 pregnancies, which is 15%, end in a miscarriage. And that is not counting the chemical pregnancies. If we count the chemical pregnancies, approximately 1 in 4 of pregnancies end in a miscarriage. So you have no worries at all. You don't need to take any extra care. I understand you are 16 weeks pregnant now, just that needs to continue as normal. So it has no extra care needs to be taken because you had a chemical pregnancy before.
Thank you, doctor. We wish you all the best, Priyanka. Next question we take from Messi. She's in 33 weeks pregnancy. She has obese and pressure, sugar, hemoglobin, everything is normal. Doctor is suggesting C-section around 37, 38 weeks. Can being overweight be a risk factor? Is there any problem for obese women to have only lower body anesthesia during C-section?
Um, Number one, during C-section, the lower body anesthesia is always the anesthesia of choice, unless you have any medical condition because of which that cannot be given. And that will essentially be that if you have a disorder with your blood clotting, or if your platelet, which I've already spoken about, if it's too low. Otherwise, it is always safer to have a lower body anesthesia during cesarean section, and that is we call a spinal or an epidural anesthesia. No, usually with obesity, you might need a more experienced anesthetist, but there should not be any problem in having a lower body anesthesia. If you are obese, the biggest risk is that there is in pregnancy, as I said, that yes, things might go wrong. Fortunately, very rarely things go wrong. Now, delivery and cesarean section, there can be complications. Now, complications are of three types. One is minor, one is intermediate, and one is major. Now, God has been very kind, and that is why the minor complications, like maybe a little bit of bleeding or maybe a little bit of infection, these are more common, whereas the severe complications are very, very rare. Now, one of the very dangerous complications is that in your pregnancy, your blood circulation slows down, very much like when you are on a long haul flight. And that is why what might happen, you might form a clot in your legs, which might travel to your lungs. And that is what tends to be a worrying issues. Now, some people are at higher risk of this, which means if you have a medical problem, then it is a higher risk of having a clot in your leg. And similarly, if you are overweight, it increases your risk of having thrombosis. And that is why you need to, after your cesarean section, you need to mobilize pretty soon. You need to drink plenty of water, and the doctor would judge whether he or she needs to give you some blood thinning injections. So I understand you are 106 kilos and 5 feet 7 inches. So you are not very overweight for your height. So be positive. Yes, you need to take protection against a possible clot in your leg. Other than that, I wouldn't really put obesity as any other risk in this pregnancy. You've
Thank you
done
so much.
pretty well with your blood pressure and blood sugar and everything. You said everything's normal, so you've done a brilliant job.
Thank you so much, Doctor, for such assuring words. We have Dr. Jaideep Malhotraji also live with us in this session. She has commented that it's a wonderful session. Uh, Thank you, Dr. Jaideep.
Thank
Next,
you, Jaideep.
next question we take from Ruby Mishra inside the iMumz app. She's 28th week pregnant with twins, and BP varies from 60 on the lower side and up to 140 on the higher side. Is this okay? She's taking 150 mg EcoSprint.
Ruby, it is important to know where you were put on EcoSpring. There are two reasons why people would put you on EcoSpring. Number one, which we call empirical. Empirical means that we didn't find a specific risk, but somebody thought that you will do well with EcoSpring. If that is so, then that is not an issue. If you are put on EcoSpring because your 12-week scan showed that you are a higher risk of developing hypertension in pregnancy, then yes, you need to be under close observation. At the present moment, your blood pressure seems to be fine. But of course, having twins, you will be under more close observation, which means that if you have dichorionic twins, then you will be having a sonography every 4 weeks, which means you'll see a doctor every 4 weeks. If you have monochorionic twins, you will have scans even at more frequent intervals, so you'll see a doctor more frequently. So yes, you need to be under close observations. And if you are already been diagnosed with a higher risk of preeclampsia, yes, you need to monitor your blood pressures pretty well. But at the present moment, it's not at a level where we will worry about. 140 by 60, we will not even think of doing blood tests, or even we will not think of doing blood tests or starting you on any medications.
Thank you so much, Doctor. Next question from Kulraj Kaur, she is 33 weeks pregnant, and while lying and getting up from the bed or chair, she's feeling severe pain near the vaginal area and the lower abdominal area. Is it okay?
How many weeks is she?
So 34th week of pregnancy. 33.
33. Yes. Usually, these musculoskeletal pains are very common in pregnancy. And if it's not bothering you too much, it wouldn't be a problem. Maybe, but if any pain you have, it's good to consult your doctor. There is only one thing which is extremely rare in pregnancy, and that you need to be worried about. What happens that your pubic bone, because of hormonal changes, can separate a bit, and it can give rise to excruciating pain, especially when you are walking or when you are changing your position in bed. The way to understand that if you find a pain in your pubic area around the pubic bone, which is you are taking long strides, and that doesn't happen if you're taking short strides, then that is something that it needs to be looked at. It is rare, but then that will not go away till your delivery. So that is something which needs to be ruled out. Otherwise, no, it just needs to be seen by your doctor and reassured that this is just a musculoskeletal pain.
Thank you, sir. Dhanashree question, in the anomaly scan, it shows that mild dilation of renal pelvis of fetal kidneys is noted. Is it serious? Please advise.
Um, Dhanashree, there are two issues here. Number one is that what happens is from kidneys, we have two kidneys, even the babies have two kidneys, and there are two pipes called ureters, which take the urine to the urinary bladder. Now, when you have a dilatation of renal pelvis, there are two things that a doctor would be worried about. Number one is dilatation of renal pelvis can happen as a part of Down syndrome, but then if you have already been screened for Down syndrome and there is no other things found, then it is unlikely that this is associated with Down syndrome. The other thing that can happen is the two other things that can cause a dilatation of renal pelvis, pelvis of the baby's kidney. One is in male babies, there could be a valve in their urethral tract inside the penis, and which can cause a problem because of which the dilatation happens. If that happens and if that persists even after birth, sometimes it needs a minor surgery by the pediatric urologist to take care of that. The second thing that can happen, it's more common in female babies, that there could be a bit of backflow of urine from the bladder to the ureters, and that is what that goes back to the kidney and causes a bit of dilatation. Now, these are the two common causes of dilatation, but then in your anomaly scan, the dilatation was there. What the sonologist would advise you to have a third trimester scan, and if the dilatation disappears, they wouldn't worry. If the dilatation persists, they'll keep an eye on that and tell the pediatrician to do an ultrasound post-delivery, and then again at around 3 months to decide whether that is associated with any problem, and then suggest adequate measures. As I said, that if it is a baby boy, it could be a valve, which might require a small surgery. If it's a baby girl, it's usually what we call is a reflux of urine, and that tends to settle with medications. But if the dilatation doesn't persist onto the third trimester, then there is nothing to worry at all.
Thank you so much, sir. Next question from Yogam. She's 33 weeks pregnant and she's doing 1 hour walk every day in 2 slots, doing yoga for almost 45 minutes. The cervix is 4.2 centimeters long in the 30th week USG. Blood pressure normal, everything was normal. And doctor asked not to take sweets because she don't wanted to come under BP and all. Okay, please tell me what are the chances for the normal delivery. The pregnancy weight has gained from 67 to 77, and what are the chances for normal?
I do not know why you've been asked not to take sweets. It's a good idea to restrict sweets. Don't have too many sweets, because you never know whether you are more prone to getting blood pressure. And you have gained 10 kilos, so that's a little on the higher side. Maybe that is the reason that your doctors asked you to stay off sweets. I wouldn't really ask you to stop sweets completely, but I think you need to restrict that. I'm sure that at 30, normally it would be, if the doctor's worried, they will request a blood sugar testing again at this stage of pregnancy. If everything stays normal, there's no reason why you cannot have a normal delivery.
Thank you so much, doctor. Next question by Balaji Ashwini. She's 29 weeks pregnant and the amniotic fluid level currently is 12.9. Is it normal?
Yes, it is completely normal.
Thank you, doctor.
We would start getting worried if it gets below 10 or if it gets above 20. You know, the amniotic fluid, there are two ways of measuring it. Number one, the one you are telling me is the amniotic fluid index, which uh, they take the measurement at the four quadrants of the abdomen, which means top right, top left, below left, and they add them up, and that is the figure is 12.9. But along with that, it is also important that what is the deepest pool, what is the biggest measurement of the four, and what it is. But 12.9 is absolutely normal. So I guess your deepest pool would also be normal.
Thanks, doctor. Seema Pillai is in 25th week of pregnancy and she's currently not feeling, she lost the sense of taste and smell after getting flu. So she's asking if it's something concerning.
At the present moment, if you lose your sense of taste and smell, even if temporarily, please remember that COVID can present. That is one of the presentations of COVID. Fortunately, those who have no other symptoms and only loss of taste and smell is likely to be mild COVID. So please consult a physician and not your gynecologist. Please consult a physician and tell that whether, and they will do a risk assessment to see whether you need a COVID testing done.
Thank you, doctor. We wish you all the best, Seema. Next question by Shalini. She's in 36 weeks of pregnancy. And how many fetal movements is it okay in 24 hours? Because she's feeling lesser movements these days.
Okay. Shalini, it is very common that once you get past 34 weeks, the baby's movements will slow down a little bit. That happens because, as you know, that the baby is there and baby is surrounded by the amniotic fluid, which essentially works as a shock absorber for the baby. Now, this amniotic fluid is at its highest at around 32 to 34 weeks. From 34 weeks, gradually the amniotic fluid starts decreasing. And the baby also starts growing bigger. So what will happen is baby will not get as much space to move as it is to get earlier. I wouldn't really advise in your normal pregnancy to start counting the baby's movements. You should count the baby's movements only if you think that there has been a drastic reduction in the number of movements. Just like there is, and never get bothered about my baby is moving too much, unless that again suddenly you find that there has been a very major change. Usually, there is nothing called excessive movements. Just like there's nothing like overactive baby. The more active a child is, we are happier. What I would think is that as you get past 34 weeks, the intensity of the movements tends to decrease, which means the kicks will not be as vigorous as they used to be. Usually the number of movements will not go down. I would advise that you should start counting your movements once you feel that the movements you think that from yesterday or day before, today's movements have been significantly less. Then how you should count? There are two ways of counting it. Number one, that you get 3 to 5 movements in 1 hour, that's fine. Number two is that you count over a period of 10 movements. And if the 10 movements usually would happen in around 4 to 5 to 6 hours, if you don't get 10 movements in 10 hours, then yes, you immediately contact a doctor. Please remember the babies have a sleep cycle and the babies usually do not sleep for longer than 1 hour, 20 minutes. So if you are paying attention, then you should be feeling a movement at least once in an hour or an hour and 15 minutes. What happens is that you will see that you feel more movements when you lie down at night, and that is essentially because you pay more attention and the surroundings are quiet. Also, you feel more movements soon after you've eaten, and because that is when the nutrients are going to the baby, and that is why the baby gets very active. So essentially, look for your movements only if you feel there have been a significant reduction from before. If the intensity of the movement decreases and not the number, don't worry about it, because that is because of the baby growing and the fluid coming down.
Thank you so much, doctor. So share the good news with all of us soon, Shalini. Next question from Shanti. She's fifth month pregnant and she's having severe headache right from the day she conceived. So why these headaches are having? Sometimes it gets uncontrollable, and these days it is getting uncontrollable. Please advise.
The headaches can occur for a variety of reasons. If your headache can occur just because of you're getting acidity, If that is so, then it is what happens in pregnancy is that there is reflux. Reflux meaning that your stomach contents are the stomach contents are pretty highly acidic, and if they are getting pushed back into your esophagus, which is your pipe that connects your mouth to the stomach, then you will get a bit of heartburn, and that can also give rise to headache. If that is so, that your gynecologist would be able to sort that out by giving you some acid reducing medications. But if that is not so, then you need to see a physician or a neurologist, because your eyes need to be checked. And if you think the headache is severe, then that needs to be looked at whether there is any other there's a neurological cause to the headache.
Thank you so much, doctor. We wish you all the best, Shanti. Bhavna has a question, doctor. She's in 6th week of pregnancy and the fetal heartbeat is 73. What are the chances of the baby's survival?
Bhavna, I would wait for another week or 10 days and get another sonography done. Usually 6 weeks, most sonologists would prefer to do the sonography at around 7 weeks, because as a rule of thumb, that if you go to, and we are talking of the weeks, we are talking from your last menstrual period, at around 5 weeks, if you do a scan, usually you will see that the pregnancy sac has developed. At around 6 weeks, that you will see that the baby has appeared. At around 7 weeks, you should see or surely see a normal heartbeat. The heartbeat is low, could be because it has been done a little early, and that's why in the next, after a week or 10 days, the heartbeat would be normal. Or if the heartbeat, sometimes the heartbeat can be low, that could be a sign of impending miscarriage. I guess you just need to wait and repeat the scan after 7 to 10 days. If the heartbeat becomes normal, then there is absolutely nothing to worry.
Thank you, doctor. Swati Sharma's question. She's in 28th week of pregnancy. Currently, the first delivery stitches, she's feeling painful there.
I need to know from Swati, this is first pregnancy, she had a cesarean or she had a normal delivery?
That detail wasn't mentioned, doctor. First delivery stitches
let's take another question, but by that time, I think she would message back.
Yeah. That's a good idea. Priyanka's question, 29th week pregnancy currently. Last 2 days onwards, she's having stomach ache. She's having constipation problem as well. Please suggest.
Okay. Priyanka, I will, not only you, I'll give everybody a very simple tip. There are several types of pain that you get in the pregnancy. If you get a pain in the upper tummy, in the center, it is usually because of acidity. If you get a pain in the lower tummy on both sides, that is called what we call is a ligament pain. And ligament pain is because as the uterus grows, the ligaments or the round ligaments do not increase in size, and they get a bit of stretch, and you can get normally you can get pain. Yes, you can get pain because of constipation also, and that is, if that is so, you can just call your doctor and ask the doctor. When would you get worried with an abdominal pain? Now, normally, if you touch your tummy and you touch on the pregnancy and you poke it with a finger, you should be able to dip that. What is important is that if you get pain along with your uterus hardening, and if the uterus hardens, then you won't be able to poke it with a finger or dip it with a finger. That is a worrying sign. That is when you must contact a doctor immediately. The pain accompanying by hardening of your tummy, that is what you should be worried about. If there is pain without any hardening, that is usually because of associated causes, which usually can be sorted out simply.
Thank you, doctor. Again, we wish you all the best, Bhavna. As doctor said, let's stay positive. Next question, Swati's question. She came back, doctor. It's her second pregnancy, and the first pregnancy was a C-section.
All right. So if your stitches are paining, that is just needs to be seen, but you needs to be examined once. But usually it shouldn't be a problem. But anytime if you think you are getting pain just on the skin side, it is good to see the doctor. Whenever you've had a cesarean section and there's a cut on the uterus, what happens is that there is a theoretical worry that the scar might be weak and it can give rise to some problems. But usually that will not happen unless the uterus starts contracting. And what is contracting? As I said, that pain accompanying by hardening of the uterus. But if you had a previous cesarean section, and if you think the stitch line is paining, then it is better to see your doctor, who would be able to tell you that whether they can reassure you. Most of the times, it will not be a worry.
Thank you so much, sir. Many pregnant women are thanking you for your kind replies and the way you have been.
It's my pleasure, and they're absolutely welcome. And if this session is helpful to them, I think that will be great, because as doctors, our aim is to have a healthy society. As obstetricians, it is our aim that everybody goes home, stay healthy, and goes home with a healthy baby. And I think there is a, it's pregnancy, or for that matter, any healthcare is essentially a two-way traffic. I think that women need to take their share of responsibility, and they only can take care of their responsibility once they get educated. So if this session was useful, I think it will be great for all of us, you, us, and the society.
Absolutely, sir. This was a very amazing session, very helpful. So sorry we couldn't take all the rest questions. Please post them in the iMumz speech section. So one of the doctors will definitely reply. We are trying to answer each and every question. So far, we have answered more than 22,000 questions. Leading obstetricians have joined and helped 22,000 questions answered. Thank you so much, everyone, for joining. The rest questions, sorry, we're unable to take now. The time is over. Please post in the iMumz tweet section. And once again, thank you so much, Dr. Bhaskar, sir, for giving your time and coming and helping all the pregnant women.
My pleasure. Thank you, Ravi.
Okay. Thank you, sir. We would love to have you sometime again soon, whenever it's convenient for you, sir.
Sure.
Okay. Have a great day, everyone. We'll be back with another Ask Me Anything session tomorrow
at 6
p.m. Thank you, sir. Have a good day, everyone.